All right, I'm gonna assess a blood pressure. I'm gonna also do, I'm gonna estimate the systolic pressure before I do the blood pressure. This is skill 2/7. So I will come in, knock on the door, introduce myself, ask their name and birthday. I will wash my hands. I don't typically put on gloves when I do blood pressures, but if it's necessary, I'll put on PPE. I'm going to come in and ask them if the right arm is okay, because it's about heart level to have it on the table here, and that's how you should do the blood pressures. I'm going to have him sit with his hand up. I'm going to expose his arm. Obviously, I'd explain the procedure before I started doing this. So I'm just going to feel for his brachial pulse, and then I'm going to apply the blood pressure cuff 1 inch above where I find his pulse. Okay. And make sure it's appropriate size. Put it on snug, but not too tight and not too loose. That. Sorry, I gotta put it up a little bit higher. This cuff might be a little bit big, but this is the only one I have right now, so can you put your hand up, sir? Thank you. Okay, keep your palm up. Okay. All right, so I'm going to put my, first of all, I'm just gonna listen to find out where his systolic blood pressure average would be, and to do that, I will just pump it up and listen or feel for it at his brachial pulse as I'm pumping it up. Pump it up. Well, I can't feel it anymore. Once I can't feel it anymore, I'll lower it down. So it was 140. So I will have to let him sit for 1 minute after doing that. Feet flat on the floor, relaxed. All right, so I need to do his blood pressure now after 1 minute. And I need to put my stethoscope in my ears, facing towards the, sorry, my cat's in the way. Put my stethoscope in and listen and feel for his brachial pulse before I take his blood pressure. Okay, now I'm going to take his blood pressure. I will go up 30 millimeters past the 140. That's the systolic that I got, feeling his brachial pulse. And listen. Systolic is 142, diastolic, when I didn't hear anything, was 60. I'm going to remove the cuff, clean everything up, blood pressure cuff, situate the patient, ask him if there's anything else he needs, give him his call light, wash my hands, and that's it.